epidemiologist. I'm not supposed to have favorites, but we do. He's also a science communicator at the U of O. Good morning, Dr. Ray.
Good morning.
I guess this recommendation by NACI was expected, right?
100% expected. And look, it's not really a booster. If you didn't mount an immune reaction the first time around, then this third dose we would consider part of the prime series. So that's not for everybody, just for those who didn't mount a sufficient immune reaction the first time. So it's expected and good news.
We spoke to a doctor earlier in the UK talking about basically how they're now back to just living with COVID. Even the Prime Minister, Boris Johnson, saying, forget about working from home, get back into the office. You don't see masks anymore in many places. And meanwhile, they had 40,000 cases in one day in the UK. Are we getting close to that point where we kind of say, okay, folks, those of you who haven't had your shots, it's time's up, we're going back to normal?
I hope not. And here's why. We still have a large population that is susceptible, meaning they're not vaccinated and they haven't had COVID and recovered from it. So they have no immunity built in. Therefore, the Delta variant will rip through them and therefore challenge our healthcare system as well. And don't forget, we still have to protect our under 12s who can't get vaccinated. So until we have sufficient immunity in the population, in Manalapi, I think probably by January we'll have sufficient immunity in the population. We shouldn't be talking about the endemic strategy. I think it's way too early for us.
Did you expect, I mean, this is your wheelhouse as an epidemiologist. Did you expect this in your lifetime?
Sort of. I wrote a couple of articles years back saying we should plan for an eventual pandemic of the flu, likely sometime in the next 5, 10, 15 years. And we've been saying that for 20 years, if not more, that this is coming any day now. But frankly, deep down in our guts, I don't think we ever thought it would happen at this level. You know, even though intellectually we knew it was going to come, emotionally it's still surprising.
So when this is behind us, are we going to remember the pandemic of 2021 in 50, 100 years, or is there going to be something in between that period that we have to brace for now?
Oh, that is a tough question. I think we are re-entering the age of pandemics to some extent. Yeah, for a number of reasons. One, we have globalization like nobody's business. So people are traveling a lot more quickly. You can get on a plane in Tokyo and be in New York before the incubation period of an infection is over. And number two, we have a lot more people encroaching into areas of the world where they otherwise would not be seen. So discovering new diseases that live in the corners of caves and things like that. And number three is we have a more intense association of people with animals. And most of these diseases arise from what we call a zoonotic origin, meaning they jump from birds and pigs into animals, and that's how they develop the genetic diversity to infect people at a wide scale.
What about dogs and cats?
Well, I think that's less likely, mostly because we don't confine them to like pens where they get sick and share diseases. It's mostly the agricultural practice of having pigs and birds in cages getting sick and swapping genetic material.
But is the beauty of having a pandemic now, I always look for the silver lining, is that we're getting our pharmacy sector in line, and therefore we can react even faster than we did when it comes to vaccines next time?
Yeah, I love your attitude, and I share your attitude. There's a lot of optimism here. We've learned about the value of science education. We've learned about the value of protecting each other, of rapid communication and good communication. And as you put it, we've learned about the value of being nimble and agile when it comes to creating vaccines and therapeutics quickly. So I think we're going to reinvest in the ability domestically and in countries around the world to create a lot of vaccine quickly. And the technologies are coming fast and furiously.
Dr. Deonandan, I always appreciate your time and your insight.
Thank you very much.